my name is Kaylee, and I am going to demonstrate how to hang a piggyback medication onto a primary line. So first we're going to look at our doctor's orders. He wants 500 milligrams of vancomycin, an antibiotic, to run over an hour. So we did the calculations here, and we'll have 500 milligrams in a 50 milliliter bag, which comes out to about 8 drops a minute. So we want to see a drop in the drip chamber every 7 or 8 seconds. There is 200 milligrams per milliliter of vancomycin in my vial, so I need 2.5 milliliters drawn up. It's an antibiotic. We're going to watch him for the common side effects, which are nausea, vomiting, diarrhea, dizziness, chance of superinfection. The dosage is usually weight-based, so doctor's calculations, pharmacy, whatever, they ordered 500, so that's what we're going to give. He has no known drug allergies, so that's good. And the reason we're going to give this, check our lab values, we're looking for like a high white blood cell count, so indicative of an infection. So I'm going to wash my hands and draw up my 2.5 cc's or milliliters of vancomycin. Cleanse the top of my vial. And I'm going to come over here and clean the port on the 50 cc bag. So we're going to dilute the medication so it can run over a long period of time. So we're injecting 500 milligrams of Vanco into 50 cc's. Now I'm going to put this in the sharp so I don't need the needles anymore. And I'm going to attach the secondary tubing. These are both sterile, so we don't need to cleanse. I'm going to close the roller clamp and squeeze the drip chamber. Now that it's prepared, I'm going to label my medication, the name of the medication, the concentration, my initials, the patient's initials, and the time I started it, and the site, which is going to be his right AC. So I'm ready to go into the patient's room with my MAR. The primary, I'm going to lower it down so that the secondary, or piggyback, is above it. We're going to assess where we're going to be using the site. So this already has an IV running. It's flowing, so we know it's patent. But we're going to check for any redness, swelling, pain, or irritation to the site. So he's good, so we're going to go ahead and use this site. I'm going to cleanse a port on my primary. It's right here. And if this were already uncapped, I would cleanse this. Attach it here. And since the clamp on the primary is below the secondary, we're not going to clamp it, or secondary won't run either. We're going to unclamp the secondary tubing and observe here for our drips. So we need one every 7 or 8 seconds, like we said earlier. And once I have it at the correct rate, it's running smoothly. I'm going to leave it here, watch it for just a second, make sure nothing happens to occlude it and that it's going to run while I'm gone. So I'll check on it periodically, and I'll come back when it's done. And going to go ahead and disconnect it. It's all done, so I'm going to clamp this roller clamp and disconnect the secondary tubing. Put a cap on it in case they need to give another round of Vanco within 24 hours. And then I'm going to reopen the primary, check the site, reopen it to establish what it was doing previously, which is 100 an hour. So as long as it's going 100 an hour, and we're asked the patient how he tolerated it, he's got no burning or irritation at the site, everything looks good, no pain there. So at this point, everything's done. I'm going to leave the patient's room and go document on my MAR. I'm going to document the site that it was given, the rate, the concentration, my name and initials, what time it started, what time it's done, and that's about it.